Hello, my name is Vanessa and I'm a renal social worker for Next Stage Kidney Care. Today I'm going to tell you about the kidney pre-transplantation process. Getting a transplant is a goal shared by many dialysis patients. While getting a kidney transplant is not guaranteed, there are tips you can use throughout the referral process to make it easier to navigate. The first step is speaking with your healthcare team, which may include your nurses, dietitian, social worker, and other healthcare professionals. Confirm your eligibility with them to begin the referral process with your physician. Not all transplant centers have the same referral process. Some require a referral from your dialysis clinic, while others prefer that you initiate the referral on your own. Adhering to your dialysis treatments throughout the pre-transplantation process is very important. Be sure to follow your healthcare team's recommendations. Make sure to communicate with your transplant coordinator at your transplant center that all requirements are met so that you're eligible to be placed as active on the kidney transplant list. To maintain an active status on the transplant list, there are important factors that should not be overlooked. For example, maintaining an active lifestyle with exercise and healthy diet. Consult with your physician to develop an exercise routine that is right for you. Also, be sure to speak with your dietitian at the dialysis clinic about your current diet to see if they have any recommendations. Your mental health is equally important to your physical health. Your dialysis clinic social worker can help you identify things to promote your own mental health. Some ideas might include surrounding yourself with positive influences, taking up a new hobby, volunteering in your community, or attending a support group. Early on in the pre-transplant process, speak with a financial coordinator or social worker at the transplant center to confirm that your health insurance covers the cost of the transplant. The scope of coverage differs between insurance companies. Some health insurers may require a prior authorization for transplant. Some health insurers may only cover a portion of the surgery, which means that you have some out-of-pocket costs may need to be covered by a secondary insurance or by you. It is important to identify at least one support person that can assist you throughout the pre-transplantation process. Some transplant centers require a support person to be present with you for all of your appointments. Be sure to have a plan in place for transportation to and from appointments at the transplant center because there may be instances where you undergo a procedure and someone else must be able to drive you home. Lastly, you should track your progress throughout the entire process. Keep track of all appointments, make copies of documents the transplant center requests, and inform the transplant center if you experience any changes in insurance, health, or living situation. Talk with your clinic social worker about questions or concerns you may have, and please note this information is to be used as a guide and should not replace any advice you receive from your physician or healthcare team.